Okay, let's get at it. What we're going to go over today is what is Medicare? We're going to go over the history, a brief history of Medicare. There are different parts of Medicare, Part A, B, C, D, and there's also something called Medigap. I'll quickly go over that. When do you enroll for Medicare? How to enroll for Medicare? We're also going to go over Medicare costs. So a lot of information in a short period of time. Let's get at it. So what exactly is Medicare? Medicare is a government-funded health insurance program in the United States. It primarily provides healthcare coverage to people aged 65 and older, as well as to certain younger individuals with disabilities, and is funded through payroll taxes, general government revenue, and premiums paid by beneficiaries. Medicare is divided into three parts, each covering specific healthcare services. Medicare Part A, which is hospital insurance, Medicare Part B, which is medical insurance, Medicare Part C, also called Medicare Advantage. It allows beneficiaries to choose to receive their Medicare benefits through private insurance plans, such as health maintenance organizations or HMOs, or preferred provider organizations, also called PPOs. Now, Medicare Part D is prescription drug coverage. Medicare provides essential health coverage for millions of Americans, helping them access necessary medical care and prescription drugs. It plays a critical role in the healthcare system, particularly for seniors and individuals with disabilities. It's important to note that there's various enrollment periods and options for medical coverage, and the program may undergo changes and updates over time, so it's advisable to check the official medical website or consult with a Medicare professional for the most up-to-date information and guidance on medical coverage. Next, let's go over the brief history of Medicare. The history of Medicare in the United States dates back to the mid-20th century and is intertwined with the broader evolution of healthcare policy and social welfare programs. Here's an overview of the key milestones in the history of Medicare. Now, back in 1935, there was the Social Security Act. Now, the Social Security Act was signed into law by President Franklin D. Roosevelt, laying the foundation for social welfare programs in the United States, while it primarily focused on old age pensions such as Social Security. It also set the stage for later expansions into healthcare coverage. Now, in the 1940s and 1950s, there were calls for healthcare coverage. During and after World War II, there were growing calls for expanded healthcare coverage as many Americans were left without insurance. President Harry Truman proposed a national health insurance program in 1945, but it faced significant political opposition and did not become law. In 1965 was the establishment of Medicare and Medicaid. On July 30th, 1965, President Lyndon B. Johnson signed the Social Security Amendments of 1965 into law. Medicare Part A and Part B. The original Medicare program consisted of Part A and Part B. Part A, like I said earlier, covered hospital care and was funded through payroll taxes, while Part B covered doctor's services and was partially funded by the beneficiary premiums. Over the years, Medicare underwent several expansions and changes. For example, in 1983, the prospective payment system was introduced to control hospital costs. In 1997, the Balanced Budget Act established a state children's health insurance program, which expanded healthcare coverage for children in low-income families. In 2003, Medicare Part D came about. The Medicare Prescription Drug Improvement and Modernization Act of 2003 created Medicare Part D, which added prescription drug coverage to the program. This allowed beneficiaries to obtain subsidized coverage for their prescription medications through private insurance plans. In 2010, the Affordable Care Act came about. The Patient Protected and Affordable Care Act, commonly known as ACA or Obamacare, made significant changes to Medicare. It aimed to reduce healthcare costs, improve the quality of care, and extend the solvency of the Medicare Trust Fund. There's ongoing updates and reforms. As Medicare continues to be a subject of policy discussions and reforms, changes to reimbursement rates, eligibility criteria, and program structure occur regularly to adapt the evolving healthcare landscape and financial constraints. Now let's talk about Medicare enrollment. Your initial enrollment period when you're turning 65 and when you're first eligible for Medicare, there's actually a 7-month window. It begins 3 months before the month you turn 65. Now, it includes your 65th birth month and lasts up to 3 months after the month that you turn 65. That is the window where you can enroll. It's also known as your initial enrollment period window. As long as you enroll before you turn 65 in those first 3 months, your Medicare effective date will be the first day of the month that you turn 65. So, if I turn 65 on June 15th and I enroll in Medicare before June, my Medicare effective date would be June 1st. The trick here is if you're born on the first of the month, the rules are a little bit different. So, if my birthday is June 1st, then I am eligible for Medicare on May 1st, starting the month prior. Now, why the confusion? I have no idea. I don't make the rules. Don't shoot the messenger. If you are collecting Social Security benefits at least 4 months before you turn 65, then the government automatically enrolls you in Medicare Parts A and B. You don't have to do anything at all. You receive your Medicare card in the mail. No other action is required. If you are not collecting Social Security benefits before you are turning 65, then you do actually have to enroll in Medicare in most cases in order to avoid a penalty. You can do that online by enrolling online at ssa.gov/Medicare. You can also call Social Security or contact your local Social Security office. Got it? Confused? Head about to explode? Well, the good news is you can play this section over and over again until it clicks. Now this slide talks about original Medicare. There's Parts A and Part B. So let's jump into the original Medicare slide. The two main parts to original Medicare, also called traditional Medicare, is simply Parts A and Part B. Part A is your hospital insurance and Part B is your medical insurance. Part A is usually free. It covers inpatient hospital care, skilled nursing home care, some home health care, and hospice, covered by Medicare Part A. Now, Part B is your outpatient medical doctor insurance. And, surprise, this part of Medicare is not free. Yes, unfortunately, you do have to pay a premium for Medicare Part B. In 2023, that premium is $174.70 per month. This covers outpatient services, doctor's visits, testing, and many other services. Now let's dive into Part A. So, when you have Medicare Part A and Part B, what are your out-of-pocket costs? We will dive a little bit into that now. Let's say you are sick and you need to go to the hospital. What are you financially responsible for? There is an inpatient hospital deductible of $1,632. It's important to know this is not an annual deductible. It's per 60-day benefit period. So you can meet that deductible multiple times in a year if you have more than one hospital stay in a calendar year. If you're in the hospital from day 61 to 90, if you're in there that long, you will have to pay $408 per day. That is your what we call co-insurance amount. If you use your extra lifetime reserve days after 90 days in the hospital, that co-insurance will go up to $816 per day. Now for skilled nursing facilities, Medicare will cover your first 20 days in a skilled nursing facility. After that, you are responsible to pay $204 per day for days 21 through 100. Once again, don't shoot the messenger. I didn't make up these rules. It is what it is. Make sure you write down these notes here, have it in front of you in case you need to reference it. Does this all make sense? If not, like I said before, play this section over and over again until it actually sinks in. Okay? So, what about Part B? What costs are you responsible for in this section? Let's dive a little bit into that. Remember, Part B is your medical doctor insurance coverage. It has a $240 a year annual deductible. What that means is that you have to pay that first before your coverage actually kicks in. After you met that deductible, you are responsible for 20% of the approved amount, and Medicare covers up to 80%. Important note to remember is that there is no cap on that. So, if you have a very big outpatient bill, you do have to pay up to 20% of that amount with absolutely no limits. But there's good news. We have some things in place to possibly help that. Next slide, we talk about steps. So, because there is no cap, many people would want to look into some kind of supplemental coverage to help cap that out of out-of-pocket exposure. They usually do that in the form of either Medigap or Medicare Supplement Plan, or look at Medicare Part C, also known as Medicare Advantage plans. Let's go over what those options are and how they work. There are two main ways to get your coverage when you are on Medicare. Let's simplify it by saying there are two main paths. Think about it. On your left-hand side is the first path. The first path is staying within the original Medicare. In this path, you can decide if you want to add Part D. Part D is prescription drug coverage. Just remember, D for drugs, okay? This is purchased separately from private insurance companies that are contracted with Medicare that offer Medicare Part D, which is approved drug plans. It can run from $5 a month in most states up to $50 a month. It just depends on which drug plan you want or need. Additionally, many people would want to add Medicare Supplement Insurance, a Medigap policy. This fills in that 20% that Medicare does not pay. It also helps pay those hospital deductibles and coinsurance amounts that Medicare does not pay. This is your secondary insurance. You can go to any Medicare doctor anywhere in the country. There are no networks associated with these plans. A good way to remember what the supplement insurance is by remembering Medigap policy fills in the gaps that Part A and B does not cover. With the supplemental insurance, you have very low out-of-pocket exposure. It provides you some potentially huge savings and also peace of mind in case something big happens to your health. The other path, so think about on the right-hand side, you can choose, is called Medicare Advantage Plan. It's also known as Part C of Medicare. These are managed care plans like HMO, PPO type plans. It basically combines the benefits of Part A, Part B, and usually includes Part D, prescription drug coverage, rolled into the plan as well. They essentially replace your original Medicare plan coverage. You do need to be enrolled in Parts A and Part B in order to be eligible for Medicare Advantage plan. Now with this plan, when you go to the doctor, they won't be billing Medicare anymore. They will actually be billing your insurance company. So your Medicare Advantage plan is your primary insurance now. You will no longer be using your red, white, and blue Medicare card anymore in your hospital visits, even though you are enrolled in Medicare. Medicare Advantage plans in most parts of the country start at $0 per month. You still have to pay your Part B premium in most cases, but the plans have no additional monthly premium. Many of these plans include additional benefits like vision, dental coverage that is not necessarily included in the traditional coverages for Parts A and Part B. Also, Medicare Advantage plans have their own set of copays, coinsurance amounts that you are responsible for that is established by your Medicare Advantage plan. All right, now, trivia time. What do you know, or actually, what do you not know? Let's start with this trivia, a little bit of fun trivia here. If you are ready, so let's do this. Question number 1, if you already get Social Security benefits, do you need to sign up for Medicare? I'll give you a few seconds to think about it. The answer is no. You will automatically be enrolled in Medicare Part A and Part B when you become eligible. You will get information in the mail a few months before you become eligible. All right, next question. Does Medicare Part A or Part B cover hospital? Part A is the answer. If you got that wrong, just go back to the beginning of this presentation when we talk about Medicare Part A on that. All right, next question. What percentage of coinsurance do you have to pay with Medicare Part B? If you said 20%, you are correct. Next question. If you are sold a Medicare Advantage plan, can you use and be sold a Medigap policy? The answer is no. Last question. Do you need to sign up for Medicare Part B if you're working and have health insurance through your current employer? This is a tricky one. The answer is no. You may qualify for a special enrollment period and be able to delay signing up for Medicare Part B without a late enrollment penalty. How did you all do? If you got them all right, congratulations. If you did not get it all right, what I recommend you doing is go back to the beginning of this presentation, watch the whole thing again as an entirety until you get very comfortable in understanding what Medicare is, how it works, how to enroll, and all of that. Well, that concludes the presentation on the basics of Medicare. I hope you enjoyed this video. If you like this video, please subscribe to the channel, hit the like button, click the bell for notification. See you all very soon. Bye.